Cervical cancer screening by human papillomavirus and cytologic contesting. Introduction. Cervical cancer is a third-leading type of cancer in women worldwide. There are approximately 500,000 new cases and 275,000 associated deaths annually. The disease occurs in highest in resource-poor countries, where more than 18% of cases occur.
The cervix is the lower narrow portion of the uterus that connects with the top of the vagina. Most cases of cervical cancer are caused by human papillomavirus or HPV. Of almost 200 strains of HPV, approximately 30 to 40 types are sexually transmitted. Some cause genital warts. Others, called high-risk types, can cause cervical cancer. An HPV virus invades a normal cell. The virus's genetic information, or genome, is released and transported to the nucleus of the host cell, where it uses host cell mechanisms to replicate. In a small group of women, HPV converts normal cervical cells into cancerous ones, which reproduce uncontrollably and do not die as normal cells do. Cervical cancer is usually slow-growing, and regular Pap tests have greatly reduced deaths from this cancer. A new vaccine prevents many cervical cancers from developing.
The clinical problem. In the United States and other countries that have developed widespread programs for cervical cytologic screening, Papillomavirus tests, morbidity and mortality from cervical cancer has been greatly reduced. Nevertheless, approximately 4,000 women die from cervical cancer each year in the United States.
So, how is your cervix doing? Wondering, do I still need a Pap test? I'm under 21. No. I've had the HPV vaccine. Yes. I've never had intimate sexual contact. No. I have only had one partner. Yes. I am in a same-sex relationship. Yes. I feel healthy and have no symptoms. Yes. I have no family history of cervical cancer. Yes. I've been through menopause. Yes. I am no longer sexually active. Yes. Talk to your healthcare provider about cervical cancer screening.
A single Pap test and limiting sensibility for detection of cervical cancer and is immediate precursor strategies routinely used in the past to compensate for the limited sensibility included repeat screening at short intervals and low cytologic thresholds for additional follow-up. However, this approach is costly and generates many unnecessary follow-up tests, such as colposcopic examination.
A cervical smear is an internal examination which is primarily done for early diagnosis of cervical cancer. Women between 30 and 60 years of age are advised to make a cervical smear for screening purposes every 3 years. A cervical smear can be made by your own general practitioner. Often it is the assistant who performs the examination. First, they will go through a questionnaire with you. To make a cervical smear, you will lie on an examination table with a bare lower body. The assistant will need a speculum to perform the cervical smear examination. Before the examination, the speculum will be brought to body temperature by warming it with warm water. Then it is brought into the vagina and the speculum is opened. The walls of the vagina are spread and the cervix becomes visible. The assistant uses a brush to remove some cells from the wall of the cervix. The brush is put into the cervix through the speculum, where the cells are removed with circular movements. Mostly, this examination does not hurt. You can have a slight sickly feeling when the speculum is put into the vagina and during brushing. After removing the cells, the examination is done. The assistant will tell you how and when you can expect the results. Sometimes some blood comes out of the vagina after the examination. That is nothing to worry about. The removed cells will be sent to a laboratory where they will be examined through a microscope for possible anomalies. In case of slight anomalies, a new cervical smear will be performed within a few months to a year. These anomalies can go away on their own. When there are more severe anomalies, further examination needs to be performed, and you will be referred to a gynecologist.
Conclusions and recommendation. For women 30 years age or older, such as the woman described in the beginning, we was recommended HPV and cytologic contesting over cytologic testing alone. Although cytologic testing alone is acceptable.
One of this screening for cancer that we have is a pap smear that can be done in our center. It's a pap smear, and what actually happens is we perform an internal examination to look at your cervix, which is the neck of your womb, and smear from this cervix is taken onto a slide and is read by laboratory people to look for any abnormalities, for example, cancer of the cervix or any abnormalities in the cells. And I feel that this is something every young reproductive lady up to the age of 65 or even 70 should do this, because it's the most easiest test that can be performed, and if detected early, cervical cancer can actually be treated. The other thing that I'm a strong believer of is of the cervical cancer vaccination, which is the HPV, human papillomavirus vaccination, whereby at the moment now in the schools we are targeting young school-going kids and it's part of the vaccination program. But I believe that women, especially me and people around my age, we were not lucky to have this in our vaccination program. So this is available now, and what it does is it helps to reduce your risk of developing cervical cancer, and also the risk of warts which are caused by this virus. The cervical cancer vaccination is available as an injection, whereby you get 3 injections in total. It's given in the schedule as the first month, and then the next one is at the second month, and the third one is in the 4th month. So all in all, within the first 6 months, it is, personally speaking, it is a bit painful, and it can be given on your arm or also in your buttocks. But that is basically the most common complaints after the injection, there is relatively very little side effects from this injection. You can get it at any time